Right, so my topic today is the effects of integrating AI into healthcare. So who would this affect? This would affect the patients and this would affect the doctors, right? So AI in healthcare, but before I begin, I want to describe what AI is. So AI stands for artificial intelligence, and what artificial intelligence is that it is an LLM model. Now, LLM stands for large language model, which uses a large amount of data and then performs calculus and statistical equations to then predict the response to your question. Now, where the data is coming from is very important, especially in AI, because there's no filter, it cannot detect skewed data, and it cannot necessarily protect confidential data. And this is very important as I'll later discuss in my project. So what would integrating AI into healthcare look like? Well, this could look like a doctor using it to help diagnose a patient. This could look like a doctor using it to find cancerous cells in a scan. And this could look like reducing emergency times. Which brings me to my thesis that introducing AI into healthcare would result in multiple effects, such as concerns regarding privacy violations and algorithmic bias in patient diagnosis. However, AI could also benefit the doctors in detecting cancers and reducing emergency response times. So going off to the privacy part, when it comes to AI, it's going to require a lot of data, but where that data is coming from raises concerns, especially in healthcare, where a lot of the data used in healthcare is very confidential, right? Your credentials, social security number, and all of your previous health data and family history, that could all be included. And if that is not properly handled, then that data could be exposed, as seen multiple times in ChatGPT and other famous AI models where confidential data has been exposed. And with privacy and healthcare being in the AI models, that would make it a prime target for hackers to try and target. The next big issue is going to be AI bias. Now, AI bias is unintentional. It's not meant to be on purpose, but it does happen, and it's just the nature of information, right? All sources are going to have bias, and the AI cannot detect when the data is biased, and it may reflect said biases when it is responding. And this could be harmful in healthcare, where it is expected to give legitimate, rational responses, when in reality, it could end up pushing bias or reflecting negative values in its responses. Another thing I want to talk about is it can reduce scan times and it can reduce emergency times. Now, what I mean by reducing scan times is it takes weeks to get a scan result. So to give you an example, if you came in with breast cancer or with another cancer, it takes 30 minutes to do the scan, but it takes a radiologist about 1 to 2 weeks to actually find anything. And in that time, your cancer or tumor could continue to grow and grow and grow. And this could be super dangerous, right? But with AI, instead of it taking 1 to 2 weeks to find any cancerous cells, it could take days or less. And then in emergency times, this could be used to find out what equipment needs to be brought to a scene before the EMS and the paramedics come. So what I want to focus on is AI bias because this is specifically dangerous, especially in healthcare, where it can taint its responses and it can be extremely inefficient and harmful. Now, Holdsworth from IBM describes AI's bias as a machine learning which refers to the occurrence of biased results due to human biases that skew the original training data or AI algorithm, leading to distorted outputs and potential harmful outcomes, right? So to give you an example, when AI bias has already occurred, Obermeyer discovered an algorithm used in healthcare which disproportionately favored white patients over black patients because it used healthcare cost as a proxy for healthcare needs, indirectly embedding racial biases in its predictions. Now this could be super harmful, and here are some examples of what risk this could pose. So the first issue is that it could inefficiently devote more resources towards groups that it favors, right? The second issue is that patients that may require more intense medical care may not receive that care because the AI is biased and it may go against said patient. The third risk that this could pose is that this could make distrust between the community and the healthcare, right? as it stands right now, there already is some distrust, especially when it comes to cost, when it comes to insurance. With having AI bias in the healthcare, this could unintentionally push forward ideals that healthcare may not represent, but the AI may unintentionally push. Right? So how can we potentially mitigate the risk of AI bias if we integrate AI into healthcare? The first thing that we could do is that we could educate the medical staff and teach them the limitations of AI, which includes teaching them all about AI bias and its effects and its risk. The second solution is that we could prevent AI from being in complete control. And what this means is that instead of using it as a sole mainstream diagnostic system, we can use it as a tool which could benefit a doctor's own judgment, which means that the doctor will do all of their diagnosis prior and then use the AI to help confirm that, or use the AI to just help them in areas they don't understand, but not as a means of complete control. The third solution is that we could create better AI that can detect skewed and biased data during the training process, which could prevent AI bias from happening altogether. Right? Well, this